Sev to take over.
Awesome. Hi, everybody. Happy Tuesday. Hope you are all well. Today, we're going to do something a little bit different than last year, where we presented Tonic and all of our assets, etc. Today, we're going to talk more about the industry as well as our content. So just a quick recap on who we are. So the next slide, please, Heather. The one just after this one. Yep. Great. Okay, a quick snapshot before I introduce Norman. Tonic Media, we are a health and wellbeing publisher within the digital out-of-home place-based media space with a reach of 16 million people each month. Our mission is simple. It's to improve the health and wellbeing of all Australians, and we do this by creating and distributing health content that is designed and curated to engage, educate, inform and entertain consumers in their point of care environments. So GP waiting rooms and Aboriginal medical service centres, as well as point of sale environments, which is our pharmacy network. Our vast network is located in 57% of all GP clinics in Australia. And we have 6,500 assets in over 4,400 health environments. Our channel consists of Tonic Television, which is a digital TV network, and we have portrait digital panels, and we also have brochure boards. Place-based media within health environments means there is a significant dwell time. We know that the average wait time to see a GP is 28 minutes. This enables us to capture and hold the attention of the health consumer in contextually relevant environments, primed to receive our trusted, credible health information. I now want to introduce you to Tonic's founder, Dr. Norman Swan, who has been an instrumental identity in improving Aussies' health by his podcast, broadcast, audio, and best-selling books. So Norman's going to update us on how to live younger longer, but also what's happening in the overall health industry. Over to you, Norman.
Thanks very much, Sev, and thanks everybody for joining and spending your valuable time with us. So that kind of lays out my agenda, but we'll get rid of that and I'll just talk to you directly. Essentially, so what I want to do is give you a sense of where health is going, the health industry is going. During Q&A, I'm happy to talk about the individual things that you might be doing for yourself in terms of living younger, longer. But I think health is a huge segment that you all deal with in some shape or form, whether it's health, well-being, wellness. By the way, I hate the word wellness, but we can come back to that one later. And and it's a massive market. They've just reassessed what the value of the market is in terms of health services, and it's something like $247 billion a year. When Tonic started 14 years ago, the health market was something like $120 billion a year. So it's doubled in about 14 years, a massive increase in expenditure. And 20 or 30% of that expenditure is waste. Stuff that shouldn't be done, that is done, stuff that isn't done, that should be done, stuff that's done too early, too late, to the wrong person in the wrong place by the wrong physician. And one of the drivers for Tonic, which is not really all in your wheelhouse, but it's with our government partners, is that we know in our environment we can change consumers and consumer decisions. So we know we can do it for you as advertisers. We know we can do it for the government in terms of changing demand. And we've shown that we can make asthma care more efficient and more effective. We can encourage people to go forward for bowel screening and what have you. But let me describe the population health of Australia, where we're heading. So Australia is always up in the top 5 or 6 nations in the world in terms of life expectancy. So life expectancy is an average. It's not really it's okay as a measure of how long on average the population is living, but it doesn't tell you about each of us individually. That's about lifespan. And when you're in marketing and sales, lifespan is what people care about. How long am I going to live, in what sort of shape? But when you look at life expectancy has been going up 3 months a year, pretty much since the mid-19th century. But it's starting to slow down. And let me give you a case study, which came out just a few days ago, which is on stroke. So you might think, stroke, that's for old people. Stroke is rising in the under 55s. We've been a success story internationally with stroke deaths. They've gone down 2 or 3% a year for the last 30 years. That's really amazing. But before COVID, that was starting to flatten out. And in fact, since 2020, stroke deaths have gone up. Now, part of that is probably COVID, but part of it is what may well have happened anyway. And the reason is thought to be, and this, these external factors come in, is obesity and diabetes. They have emerged and they are serious risk factors for stroke, heart disease, dementia, and so on. And it's not just for old people. And stroke is a significant cause of disability. So we're doing pretty well, but we're not doing as well as we could or should. However, if you look at life expectancy in more granular detail, a baby girl born today, the life expectancy on average would be 85. But it depends where that baby girl is born. If that baby girl is born in a reasonably well-off suburb where people are well educated, that baby girl is going to live to 100 unless something really catastrophic happens to her. Baby boys as well will live to their late 90s. Whereas if you're born in an Aboriginal community in a remote part of Australia, it's very different. So we talk about the gap, the unacceptable life expectancy gap between non-Indigenous and Indigenous Australians, as it's about 8 years. But in fact, if you take the longest lived postcode in Australia and the shortest lived postcode, that gap is actually, believe it or not, 45 years. That's between APY lands and the average upscale suburb in one of our capital cities, 45 years. And that's what happens when you disassemble the market, if you like, or the population statistics. And it's important that as marketers, the marketers understand that. I'm sure you do, and you've got lots of data, but the data show you what's happening in different parts of Australia, in different communities, and what needs to be done in terms of communication and what the opportunities are. So one of the disruptors at the moment is in fact overweight, obesity, diabetes, and of course counter to that, and I'll come to that in a minute, is the Ozempic revolution, or those kinds of drugs. Is that a disruptor in the other direction? And some really interesting things may be happening as we go along. You'd be disappointed if I didn't talk about COVID. COVID is still around. In the last week, cases, the rolling average of cases, we don't really know how many cases there are because we're not reporting them, we're not getting testing done. But there are ways of looking at it in terms of hospitalizations and so on. But it looks as though cases have gone up by about 15% in the last week in New South Wales, 19% in Victoria. So it's still around, it comes back. Deaths are very low, thankfully, two or three a day. But there's been 5,000 deaths this year already, at least. Last year, there were 20,000 excess deaths due to COVID, 20,000. So that's COVID deaths, plus deaths from coronary heart disease and stroke in particular, but also dementia. So dementia goes up with COVID as well. Dementia is, one of the things that we talk about a lot in terms of the aging, so-called aging population. But in fact, the good news is that dementia rates are falling. So dementia rates, so this is age adjusted. For your age, your chances of getting dementia are actually falling. They've probably dropped by about 25% in the last decade, and that's globally in high-income countries. Cancer rates have also fallen by age. There are more numbers because there are more people getting into older ages, and ages are a significant risk factor, but your risk of it at a given age has gone down, which is fantastic news. And the reason for that is that we are healthier. The reasons we're living longer also protects us against dementia. So what are the reasons that we're living longer? Well, education is a huge predictor of how long you live. The longer you go on in education, the longer you live, the later you develop dementia, if you develop at all, the later you develop cancer and coronary heart disease. So we're actually already living healthier longer. But we do accumulate diagnoses as we go. It's not as if we get to 90 and everything's hunky-dory, we've never been to see a doctor. There are some people like that, but they're not very many. So we accumulate diagnoses. There's 12 million Australians with what's called a chronic disease. and which is, and that, again, that's an important target for all of us. So what's wrong with these people? Well, it could be asthma, it could be diabetes, it could be heart disease, it could be stroke, it could be a bit of arthritis. But modern medicine is pretty good about getting you in pretty good shape. So you might get a 90, you might have well had your knees done or your hips done, you might have got a couple of stents in your heart, but you're doing pretty well, thank you very much. You might be on cholesterol lowering drugs. So it's not cost-free getting to that age, but it's in pretty good shape with your brain in good shape as well. And the key now is that a lot of people are going to get to their 90s. While I'm talking about that, let me just talk a little bit about aged care. Massive market now with boomers and older, people, well, basically it's boomers, getting into that retirement age and beyond. And the market has changed. So the market for residential aged care has probably dropped relative to the age of the population. So a similar story to cancer and dementia and so on. People want to age in place at home. They want to stay in control of their lives. And that's an important factor in living younger, longer, because that sense of control you have over your destiny, and some of you may have read my books talking about that or heard me talking about it, is that it's called locus of control. Where do I control my life? If you control your own life, the decision-making about your life and work, and it's with you rather than over there with disadvantage, deprivation, lousy job, lousy boss. None of you are in a lousy job. None of you got a lousy boss, but you know what I mean. That actually creates chronic stress. And this is solid research. And that chronic stress prematurely ages you. Your immune system goes on the alert, and that going on the alert causes inflammation and prematurely ages every tissue in your body. Your blood pressure goes up, your pulse goes up, your stress hormones either go up or they go down. And either way, that creates changes in your appetite, risk of diabetes, and so on. So what the voice was about, by the way, was returning locus of control to communities and actually reducing that premature aging. It wasn't articulated very well, possibly not understood very well, but that's what that was about. And it's about each of us as well. And the more educated we are, the more choices we have in life, the more money we've got in our pockets, the more locus of control is with us. And it is an important reason why we age more slowly. And biologically, we get to 90 with fewer miles on the clock. And things that reverse those sort of things of aging are exercise and nutrition. So exercise is already a massive market in various forms. And what exercise does is it actually rejuvenates every cell in your body. You tend to think it's good for my heart, maybe good for my brain, but in fact, exercise at reasonable intensity rejuvenates most tissues in the body. So the exercise market moving forward is going to be incredibly important, tailored to an older population. So there are going to be lots of opportunities there. So there are clinicians doing it, exercise physiologists, but massive opportunities there for gymnasia and others, and also helping people in place at home. Really interesting studies showing that you can be frail and elderly. You can prevent that happening by doing lots of muscle strengthening exercise. You can be frail and elderly and have a strength training intervention at home, and it can actually, when you do the muscle biopsies, it turns your old muscles into young muscles. So those are the kind of opportunities. And aged care home services that are tailored to individuals, it's already happening, but the quality of those services is really not, we're not sure what the quality of those services are, just like we have had problems with aged care, residential aged care. And so there will be, I anticipate, some issues to do with home care and the home aged care growing as time goes on, because boomers will demand high quality care. But there is a problem here, and the problem goes out throughout the health industry, which is workforce. There is a shortage of general practitioners. There's a shortage of people working in primary care, and there are things happening in the market which are changing how care is going to be delivered, or an absence of care. So let me just talk about something that a lot of you know about, which is ADHD, attention deficit hyperactivity disorder. A lot of people are getting diagnosed with it now as adults, and a lot of them are undiagnosed. I suspect some people are being overdiagnosed with it, but by and large, there's a whole cohort of people who are undertreated with ADHD. However, it's been an entrepreneurial opportunity for psychiatrists. So psychiatrists are charging anywhere between $500 and $900 for a session to assess you and then prescribe for ADHD. So that sounds fine. They're treating people who need to be treated for their problem. General practitioners, though, are finding it almost impossible to get hold of a psychiatrist for people with bog ordinary mental health issues, but serious ones like depression and anxiety, because the psychiatrists have been sucked away doing telehealth consultations for ADHD. But when things happen, you get untoward consequences. So we do have a mental health issue. We do have a mental health crisis, particularly post-COVID, particularly in younger people, of psychological distress, which means depression, anxiety. We have constant problems in terms of psychosis, particularly drug-induced psychosis from methamphetamines, marijuana, and so on. And we've got a shortage of psychiatrists because they're not actually doing the job that they were trained to do, which is treat the broad spectrum. This brings me to the disruptors in the system. So what is going to happen? I mean, the Ozempic revolution is simply amazing. It's been years since there was a blockbuster drug. Last time was probably cholesterol. But here we have a drug, or a family of drugs, that treat diabetes pretty effectively. And then they noticed the side effect that people lost weight. They lost their appetite. They are not perfect drugs. It's been presented as that they're somehow magical. You get reflux, you get constipation. Some people get paralysis of their bowels. There's a small group of people who actually get depression as a result of the medication. So they're not side effect free. They're also not cost free because you pay for it out of your own pocket. But they do induce a very significant weight loss, and they do seem to protect the heart, probably the kidneys, and maybe the brain as well. So could we get to a situation where by taking these weight loss drugs, stabbing yourself once a week with the injection, that obesity comes down, diabetes comes down, coronary heart disease comes down, drug induced, but nonetheless comes down. Maybe even dementia rates fall even further. Something really interesting going on. So some people are being entrepreneurial here, and they're creating weight loss clinics built on telehealth, built around these weight loss drugs. The problem with that is that what the people who really understand weight loss, these drugs are not magical, and you actually need to change it. They do not substitute for changed lifestyle. So research has shown that if you lose weight and don't adjust your diet to a healthier diet, so let's say you do the Michael Mosley 5-2 and you eat the normal crap on your 5 days on, and then you starve yourself on 2 days, you'll lose weight, but you're metabolically unhealthy. You've actually got to eat the Mediterranean style diet with a large variety of vegetables, not much, the story, red meat and so on your days. And it's similar with Ozempic, is that you've actually got to eat really healthily, highly densely nutritious foods, not supplements, foods, to actually get the metabolic benefits. So this is all going to shake out, but it's actually potentially exciting. And there are also exciting things happening in mental health, but they're expensive. So psychedelics, psilocybin, magic mushrooms, MDMA, and ketamine, which is probably a psychedelic as well. So the story here is it's early days, and they are not set and forget. So with psilocybin and MDMA, it's to assist psychotherapy. So it's to assist the psychologist talk to you about your depression problem. And the initial findings are pretty positive, but there are side effects, and there are side effects from the psychotherapy. People are not sure what the right psychotherapy is when you're giving a psychedelic. 30% of people who are treated for depression are resistant to the standard forms of treatment, so they need something. Ketamine, the people who use ketamine say it's unbelievable. They've never seen anything like it. A dose of ketamine can actually be like electroconvulsive therapy. It just turns off the depression. But here's the problem. We don't know how many sessions how many doses you need over what period of time. And some people can relapse incredibly quickly and incredibly deeply and put themselves at risk from self-harm. So we've got to learn a lot about these drugs, which have a lot of hope, but they're very expensive. I mean, a ketamine course can cost you $20,000-$30,000. And so can, psilocybin therapy can cause a course of that, which is 1 or 2 treatments, can cost $20,000. So this is not a mass therapy, at least not at the moment. So we've got workforce, and then the workforce to support all this is fragile. And the question is, what do we do about it? What incentives do we create? What training? Do we need doctors to do everything? Can't we have nurses doing more, prescribing nurses and so on? But general practice has to be the core of the healthcare system, and it will be moving forward, which is why Tonic is largely based within general practice, because that's where your healthcare journeys start. And if you get off to a bad start in general practice, you can go off and do something. I'll give you a simple example. If you've got knee pain and you do the wrong imaging, you send you off for an MRI instead of just a plain X-ray, you see things on that X-ray which you were never meant to see. And then you're off at the knee surgeon before you know it, having unnecessary knee surgery where you could be rehabilitated. Same with spinal surgery. What happens in general practice makes a huge difference to individuals, their quality of care, their quality of life, and the cost to the system. And that's why we are based largely in primary care, pharmacies, general practice, in particular Aboriginal medical services, so we can help to intervene, change people's lives towards a healthier lifestyle, help them. We know that we can trigger consumers to ask questions of their doctor and nurse, which change the care that they subsequently get. So it's an important place to be. I'll stop there, and I'm going to hand over to Emma Vidgen, our head of content, to talk about what we put on our screens to achieve the sort of things that you want to achieve, as well as the system wants to achieve for individuals for better health.
Hopefully you can hear me okay. Thumbs up. I think so. So
Emma, your volume is very low.
okay. Let me just see if it's. How did that sound?
It's still very low.
Okay, I'm gonna just have to. Okay. So then, sorry. Can you just repeat, Norman?
Your volume's still very low.
And you're breaking up.
And you're breaking up, yeah.
Okay. I might just don't let it go.
What we might do is that while Emma's sorting out her, can you hear me?
Yes, we can. Yes, we can.
So just to lubricate this, while Emma's sorting out something happened with her volume, is Emma's doing a fantastic job of driving content here, which is that we started off actually as a production house and then expanded into being Tonic. And we have a division called Tonic Education, which is about changing behavior. And many advertisers are actually taking advantage of that, where we can produce content and drive it in a very trusted environment. And we have a video here, I think, don't we, Emma, just to illustrate what we do? And Heather might play that while Emma checks out her sound.
Like fun to me. You look a little like somebody I know.
People get anxious if they're, say, sleeping 6 hours a night and thinking that they're heading for dementia. It's a misconception. The issue with sleep
is not necessarily how long you sleep for, but the quality of sleep.
I don't think there's a need for an X-ray and a scan. An X-ray and a scan are just going to show that the joints and the muscles in your back just aren't as young anymore.
Strength training is only for young people or men, and that's absolutely not true. Strength training is really important for people of all ages and genders.
Feeling sick? Staying home helps you get better, faster, and protects your workmates.
Australia has one of the highest recorded rates of rheumatic heart disease in the world. This means that our young people are having surgery way too early in their lives. We can prevent this damage from happening.
Ways to prevent type 2 diabetes is maintain a healthy lifestyle, regular physical activity, a healthy diet, limit alcohol consumption, and not smoke.
In 2023, Australians will decide if we should improve our constitution. The question is simple. Should Aboriginal and Torres Strait Islander people be allowed to formally contribute to discussions about policies and laws that directly affect them?
Want to have another go, Emma? No, it's still pretty lousy. I don't know what's going on there. Since I've heard Emma's presentation before, why don't I translate for that? I mean, essentially, what Emma provides is full service content production, and we obviously, a lot of what we use is your material that you might give to us, but we also can do creative production, particularly when it requires good content knowledge and help with curation. And that comes from essentially our programming content, but also what might be our advertising and marketing content. And we're on a digital platform where we can actually program down to the individual screen if we have to. And in fact, in some Aboriginal communities in our Aboriginal Health Television Network, we've got different content going on different screens in the same, to be culturally safe. So there's a lot that can be offered, and you saw a sample of that there.
Norman, do you just want to try?
Oh, that's good. You're good.
Can you mute?
Yeah, you can talk now.
I think that. Okay. How's that sounding? Third time lucky. Gosh, I hope this is worth the wait, everyone. So there was a little bit of a spoiler there. My apologies for the technical difficulties, but I really, really wanted to build on what Norman introduced in terms of what the future of health is. And now that we have had a peek inside the crystal ball to see what may lay ahead, I think we can all agree that there is no shortage of information and advice and options available to people. That's one of the really key takeaways, I think, that resonated with us. And with so much change and innovation and opportunity, we all want to become our own experts. I don't think there would be too many people on the call today who have not Googled something before they even think about going to the doctor. It's just the way we behave these days. And it's wonderful that we can do that, and we can jump online and we can find a YouTube or a podcast or whatever to figure out if that weird rash is actually something we should be seriously concerned about. But actually finding information that we can trust has never been more difficult. And we think that that is where Tonic comes into the mix in a really exciting way. Because every media business these days is a content business, and we are no different. We are not just a distribution platform, but a full service content agency, as Norman mentioned. But what makes us different is that we create trusted content. And, you know, trust is something that has been really part of our mission and our legacy, and something that I'm sure most of you are familiar with in terms of what our offering is in market. We have always been about trust, and that has driven all kinds of products like Aboriginal Health Television and our virtual waiting room app with CoView. These kind of opportunities only come up for us because we are a trusted voice in the market. And while anyone can make content, and we can all go online and find a fabulous recipe for vodka pasta, or book a trip away and self-diagnose ourselves with a chronic condition before 10 a.m., not everyone can create content that is genuinely trusted by consumers. And this is not just coming from within Tonic, drinking the Kool-Aid. We have the data. I believe it is 94% of consumers who say that the content that they see on screen with Tonic is content that they can trust, and that's phenomenal. So you imagine that you bring that legacy of trust to a content business, to a content agency, and you've got something very special. I am going to mix things up by quoting some Spider-Man, because why not? And I believe it was Peter Parker that said, with great power comes great responsibility. And here at Tonic, we believe that knowledge is power, and we take that responsibility very, very seriously. We don't just see ourselves as a place-based media business that has operations in practices and pharmacies, waiting rooms, telehealth environments. We really see ourselves as being with consumers at their most vulnerable, when they are waking up at 3 o'clock in the morning and Googling, why do I always wake up at this time? Or why do I have heartburn? Or is this a sign of early cancer, or so on? And we take that very, very seriously. And it's that sense of responsibility and trust that we bring to all of our content, and that we're excited to hopefully partner with you in some of the ways that you've just seen in that video. So health and the world is moving faster than it ever has before, and there's never been a greater sense of urgency or more difficulty in cutting through. So next time you find yourself in a situation where you're kind of in a rut, or you're wondering what the best fix is, or it's just a really tricky brief, ask yourself, is this an opportunity that needs content? Is this an opportunity that needs trust? Or is it an opportunity that needs both? And hopefully you might think of us, which is a wonderful segue to my colleague Seb, who is right next to me, because my computer didn't work. She's going to talk you through.
Oh no, I was actually going to see if there was any questions, and yeah, and thank Norman as well as Emma, and whether you have questions for Emma or Norman, you can put your hands up or just put it in the chat. No, no. Well, that was actually it from Tonic. Again, if you want, sorry, no. Yeah, if you want to engage with us in a more deep and meaningful way and integrate into our content, then talk to us. Beck and Nikki, thanks a lot for hosting, and thanks everyone for joining in.
Thank you so much, Sev. Thank you, Dr. Swan. That was a really insightful session, so we're very appreciative. Any questions, feel free to reach out and we can pass the team's details on. Have a great day, everybody.
Thanks, everyone.